Hello, I am Professor Oleksii Kalmykov, MD, DMed Science. High blood pressure, proven steps plus emerging science. If you're over 60 and living with high blood pressure, there's one message that matters most. Controlling blood pressure reduces your risk of stroke and heart failure. This is true whether you do it with lifestyle changes, medication, or, most often, both together. Blood pressure control saves lives. Now, you may have heard about a molecule called irisin. Irisin is a myokine, a signaling protein linked to muscle activity. Researchers are studying whether it reflects aspects of metabolic and cardiovascular health. But here is the responsible, evidence-based view. Irisin is not a standard clinical test for hypertension, and test methods can vary widely. In other words, you should not make treatment decisions based on an irisin number. So why discuss it at all? Because it points to something we already know from strong evidence. Your muscles matter for your vascular health. Regular physical activity, including strength-focused exercise, can lower blood pressure and improve function in older adults. Let's separate what is proven from what is still emerging. First, the DASH-style eating pattern and lowering excess sodium can reduce blood pressure. Multiple trials and systematic reviews support this. Second, resistance training can also reduce blood pressure. The average improvement is usually modest, but clinically meaningful, especially when combined with aerobic activity, weight management when relevant, and medication when needed. Third, treating sleep apnea, when present, can modestly improve blood pressure control and daytime symptoms. If you snore loudly, choke or gasp at night, or have severe daytime sleepiness, discuss evaluation with a clinician. Emerging, irisin may change with exercise in some studies, but results are inconsistent and measurement remains a scientific challenge. So we treat irisin as a research topic, not a must-check lab. Now let's talk about a safe, senior-appropriate action plan that is consistent with guidelines. Note, this is educational only. Do not change medications without your clinician. Strength-focused movement, 2 to 3 days per week. If you are new, start small. Use stable support. Choose movements that feel controlled and do not provoke pain spikes or dizziness. Breathe continuously. Avoid breath holding. If you have major balance problems, severe joint disease, recent heart symptoms, or recent surgery, consider supervised guidance from a clinician or physiotherapist. Example options: sit to stand from a sturdy chair, wall push-ups, resistance band rows. Keep it comfortable to moderate. The goal is consistency, not intensity. Walking most days, adjusted to symptoms. A short walk after meals can help some people, especially for glucose control. But an important caution for older adults. Many experience postprandial hypotension, a blood pressure drop after eating, which increases fall and fainting risk. If you feel lightheaded after meals, do not push through. Talk to a clinician and prioritize safety. Food pattern, DASH principles. More vegetables, fruits, whole grains, legumes, and low-fat dairy if tolerated. Less ultra-processed food and excess sodium. This is evidence-based for BP. Important: potassium-rich foods can be helpful for many people, but not for everyone. If you have chronic kidney disease or take medicines that raise potassium, you need individualized advice. Keep the proven stop rules. Stop exercise and seek urgent care if you develop chest pressure, severe shortness of breath, fainting, new weakness, numbness, or a sudden severe headache. Finally, I need to address cold showers and cold plunges. Cold exposure can trigger a rapid rise in breathing, heart rate, and blood pressure, the cold shock response, and it can provoke rhythm problems in susceptible people. It is not a standard hypertension treatment, and I do not recommend it as a BP lowering strategy for seniors without clinician clearance. Bottom line, if you want to protect your heart, focus on the interventions with the strongest evidence: blood pressure control, regular physical activity, including strengthening, diet quality, and evaluation of contributing conditions like sleep apnea. Biomarkers like Irisin are interesting research, but they are not the foundation of safe hypertension care today. This content is educational and is not personal medical advice. If you have symptoms, multiple conditions, or questions about medication changes, discuss them with your healthcare professional.